Welcome back, everyone, to the GuideWell Insights Lounge. My name is Kate Warnock. I'm delighted to bring Dr. Grace Terrell as our next interview. Dr. Terrell, welcome to the interview.
Good morning.
Everyone, Grace Terrell is the president and CEO of Cornerstone Healthcare. Dr. Terrell, this morning you spoke on a panel about leading and sustaining a company through disruptive times. You were there representing a very large practice, and I wondered, what is it that you shared? What perspective did you provide in that panel?
So what I talked about this morning was how we transitioned a very legacy multi-specialty medical practice into one that was focused on value, all the pivot points that it required, including completely redesigning the way we were providing care through new care models, at the same time that we were changing the way we were paid, at the same time that we were investing in clinical integration as well as information integration with new predictive modeling tools. And so a lot of what we were talking about this morning as it relates to change and leadership is just the complexity of that as you're going through what ended up being, on our part, some very successful outcomes, but the journey itself has been somewhat messy.
I think that's a very honest answer. Well, one thing that we spoke to you last year, we were able to speak with you, Dr. Terrell, was about how to integrate IT so that your patients can really get the best possible care. So you just mentioned you've been implementing predictive modeling. I was wondering if you could tell us, how is it that you know when to bring in new systems and how to invest and when to invest, and how is it that it really is benefiting your patients?
Sure. So I think that IT in healthcare is in about early stage 3 of 5 stages. If stage 1 information technology was all about billing and collecting and revenue cycle management, it's 30 years old and it's mature technology. The electronic health records and work that is focused on
Go ahead.
You want to just keep continuing on? Okay.
Technical difficulties.
Technical difficulties.
Sorry about that.
So the electronic health records are stage 2, and that is becoming more efficient, and it's related to the care, the clinical care that's given at the site of the practices. But where we are now in actual health information technology is really at the very forefront of population health, and it's about identifying patients with gaps in care or those who have more critical needs through registries, through figuring out through both claims as well as clinical data from all sorts of points of truth, if you will, or all points of sources, who these patients are and how we might do a better job in terms of being proactive with their outcomes. So when we first started going down this road, there were not particularly good tools available because the technology was so immature. As we've gone on, we have been able to identify several partners, strategic partners, that are helping us get further down the road, and we're doing some of the development of those products ourselves in co-development. So we've worked with Optum. We're working with a company called Lightbeam. With them, we are basically identifying patients that need different types of care and putting them in care models. And we're starting to see some real results.
So that makes a lot of sense to me, that kind of approach, because you're using real-world practical applications and then building the product to make sure that it meets those needs. So that sounds like a really smart approach. You know, Dr. Terrell, another major theme here at the Health Innovation Summit is precision medicine and how it's going to upend traditional care delivery. How is it that you're beginning to see that affect your practice?
Well, you know, precision medicine is in its infancy, but it's going to be probably the biggest game changer that anybody has ever thought about. So one of the things that we've done at Cornerstone is we have a company that we've spun off that's a population health enablement company to help legacy health systems get to where they need to be. One of our strategic partners in that is LabCorp, and the other one is Wake Forest Baptist, both of who are investing very heavily in the future as it relates to precision medicine, where you can take genomics, where you can take big data, and you can identify for patients very specific needs as it relates to medicines. At Wake Forest Baptist right now, you can actually do a far better job at identifying patients with cancer what the exact chemotherapy regimen would be. So this is early in its development across the United States. Within the next 5 years, I think it's going to be absolutely, just very mainstream. We're very fortunate to be affiliated with a partner with two partners who are on the mainstream part of that. So what we're looking at CHESS and at Cornerstone will be how will we integrate this into new models of care with our ability to identify patients who have needs, and then not only think about the care models and smart care teams, but actually smart medicine,
right.
Or as it's becoming called, precision medicine.
So you've been practicing medicine for
a long time.
Long time. Good way to put it. Do you consider precision medicine probably the most disruptive change in your career?
Yes, and I don't think most of the traditional healthcare community realizes yet how disruptive this will be. If you think about, if you just take pharma, for example, the pharmaceutical industry has made most of its business models around blockbuster medicines, where, for example, with a statin, you might treat everybody in a population with a particular statin who has a risk of heart disease. Well, imagine in the future where you're going to be identifying who needs that medicine and who doesn't need that medicine. Right. So particularly for the pharma, but I think for all of us, it's going to make things far more precise, but it also may mean that we're going to have to develop brand new business models to help not only fund it, but to create sustainability for continued innovation and development of these new ways of providing care.
I have one more question for you, Dr. Terrell. You know, we're beginning to see a far greater collaboration. We just had the president of GuideWell on, Renee Lair, talking about far greater collaboration and really trying to drop that competitive approach between payer and provider.
Yes.
How do you see that evolving within your practice too? Do you see more collaboration and delivering more kinds of these hybrid products to benefit your patients?
So I think that the new healthcare ecosystem is going to be far more about collaborations. None of us in the legacy healthcare system have all the assets that are going to be needed for the new healthcare ecosystem, but we've all got a part of it. So as opposed to seeing everybody out there as your competitor, you need to understand what they bring to the table and work together, not so much with these legacy vertical integrated models, but in a clinically integrated model that's based upon understanding who has what to bring to the table. So I think that in the future, some healthcare delivery systems are now called medical groups, and some are called hospitals, and some are called insurance companies. In the future, none of those things are going to be what they are now, and they all may actually be something together in a very, very different business model, which if we get it right, is going to be very good for patients.
That's a very compelling vision, and I hope to, get to talk with you again as we walk towards that very interesting future. So, Dr. Terrell, thank you again for putting up with our minor difficulty.
That's all right.
Appreciate you coming here today. This is Kate Warnock. We'll be back again with you in just a few minutes.
My pleasure.